Welcome to another episode from the Veterinary Research Channel. Today we are diving into a fascinating case report that explores an unusual presentation of a rare condition in a Chihuahua. This report, published in the Journal of the American Animal Hospital Association, details the long-term outcome of a Chihuahua with idiopathic syndrome of inappropriate antidiuretic hormone secretion, or SIADH. Our story begins with a 3-year-old female Chihuahua who was brought in for evaluation. Her owner had noticed that she was experiencing excessive thirst and urination, also known as polydipsia and polyuria, after adoption. Initial tests conducted by the primary veterinarian revealed some key abnormalities, including hyponatremia and hypochloremia, which are low levels of sodium and chloride in the blood, respectively. Further tests ruled out common causes such as heartworm, Lyme disease, and other infections. The diagnostic journey continued with a series of blood tests, a urinalysis, and an abdominal ultrasound. While some results were normal, the hyponatremia and hypochloremia persisted, raising concerns about an underlying condition. The abdominal ultrasound showed some mild changes in the liver and kidneys, but nothing definitive. To further investigate, the veterinary team at the University of Florida Small Animal Hospital performed additional tests. These tests confirmed the presence of hyponatremia and hypochloremia, along with low serum osmolality, which indicates an imbalance in the concentration of electrolytes in the blood. Interestingly, the dog's urine osmolality was not as low as expected, given the low serum osmolality. This finding suggested that the dog's body was retaining water inappropriately. To get a clearer picture, the team measured the dog's antidiuretic hormone, or ADH, and copeptin levels. ADH is a hormone that helps regulate water balance in the body. In this case, the dog's ADH level was slightly elevated, which was considered inappropriate given her low serum osmolality. Copeptin, a surrogate marker for ADH, was also elevated. These findings further supported the suspicion of SIADH. After excluding other potential causes of hyponatremia, such as kidney, liver, and adrenal disorders, diuretic use, and thyroid dysfunction, the veterinary team arrived at a diagnosis of idiopathic SIADH. Idiopathic means that the underlying cause of the condition could not be identified. In other words, the dog's body was inappropriately producing ADH, leading to water retention and electrolyte imbalances, but the reason for this was unknown. Now, what makes this case particularly interesting is that the dog's only clinical signs were polyuria and polydipsia. In many cases of SIADH, especially in humans, neurological signs are more common. However, this Chihuahua remained relatively stable, without developing any other clinical signs. Initially, water restriction was recommended for this dog, which is a common approach to manage SIADH. However, the owner found this to be impractical. Instead, they opted to supplement the dog's diet with a small amount of salt. While this did not completely resolve the electrolyte imbalances, the dog remained in good health for 2 years following the diagnosis. This case report highlights several important points. First, it reminds us that SIADH should be considered as a potential cause of hyponatremia in dogs, even in the absence of typical neurological signs. Second, it demonstrates the usefulness of novel diagnostic tests, such as copeptin measurement, in the diagnosis of SIADH. Finally, it suggests that the long-term outcome of idiopathic SIADH in dogs may be more favorable than previously thought, even without specific treatment. Of course, there are some limitations to this case report. For example, brain imaging was not performed, which could have helped rule out other underlying causes. Additionally, serial ADH measurements were not available, which could have provided more information about the dynamics of ADH secretion in this dog. Despite these limitations, this case report provides valuable insights into the diagnosis and management of SIADH in dogs. It also raises interesting questions about the underlying mechanisms of this condition and the factors that may contribute to its variable clinical presentation. To recap the diagnosis of SIADH, several criteria must be met. Hyponatremia, which is low sodium levels in the blood. Inappropriately high urine osmolality, given the plasma, hypoosmolality. Continued renal excretion of sodium. Exclusion of other potential causes of hyponatremia. In veterinary medicine, SIADH is uncommonly reported in animals. When it is seen, it has been associated with conditions such as hepatic dysfunction, congenital disorders, and traumatic injuries. The clinical signs of hyponatremia are more related to how fast it comes on, not the severity of the hypoosmolality. Even asymptomatic chronic hyponatremia in humans has been associated with gait abnormalities, falls, and attention deficits. Current management of SIADH in canines involves water restriction as the main therapy. If water restriction alone is ineffective, dietary manipulations to increase the solute load through sodium administration, urea supplementation, and Vasopressin V2 receptor antagonists can be considered. In conclusion, this case report highlights the importance of considering SIADH in dogs with hyponatremia, even if they do not have the typical clinical signs. It also emphasizes the need for further research to better understand this complex condition and improve its diagnosis and management. The case also highlights that SIADH does not require increased plasma levels of ADH because osmostat resetting or genetic mutations of the vasopressin receptor in the renal collecting duct can cause hypoosmolality. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.